Imagine for a moment that a massive electrical storm is brewing, not in the sky above you, but inside the delicate, intricate wiring of your own brain. Long before the first crack of thunder, that pounding pain we associate with a headache. The storm has already darkened the horizon, your mood shifts, your energy crashes, and your senses go haywire as a slow-moving wave of electrical silence creeps across the surface of your brain like a tsunami. This isn't just a bad headache. This is a global neurological event that holds your entire nervous system hostage. If you or someone you love suffers from migraine, you know exactly what I am talking about. And today, we are going to validate that reality with hard science to explain why migraine is so much more than just pain. Before we dive into this journey through the migraine brain, I want to invite you to join our community here. If you find value in understanding your health on a deeper level, please take a second to hit that like button and subscribe. It really helps us reach more people who need to hear this message. And I'd love to have you with us for the long haul. I also want to be clear that while I am a doctor, I am not your doctor. And this video is for educational purposes. The information we are discussing today is backed by rigorous peer-reviewed research and guidelines from top medical institutions. I've listed all the authentic medical sources and organizations in the description below so you can verify everything we talk about and feel confident in the information you're receiving. Let's start by dismantling the biggest myth of all, the idea that migraine is just a headache. Calling a migraine a headache is like calling a hurricane a bit of rain. The headache is just one symptom, a loud one, sure, but it's actually the end result of a cascade of events that starts days before you even feel pain. We now know that migraine is a complex genetic neurovascular disorder. It's a problem with the way your brain processes sensory information. In a non-migraine brain, the hum of the refrigerator or the glare of sunlight is filtered out as background noise. But in a migraine brain, the filters are broken. Your brain doesn't just hear the noise. It amplifies it until it becomes unbearable. And this process often begins up to 48 hours before the pain hits in a phase we call the prodrome. Have you ever noticed that a day or two before a migraine, you feel off? Maybe you're yawning uncontrollably, or you're suddenly craving chocolate or salty snacks. Maybe you're irritable, or you have to urinate frequently. This isn't random. This is your hypothalamus malfunctioning. The hypothalamus is the control center deep in your brain that regulates hunger, sleep, and fluid balance. When it starts misfiring, it sends out these warning signals. You aren't craving chocolate because you're hungry. You're craving it because your brain is desperate for quick energy to handle the coming metabolic crisis. For about 1 in 3 people, this silent storm eventually triggers something even more terrifying, the aura. And this is where the science gets incredibly visual. We used to think aura was caused by blood vessels shrinking, but we now know it's caused by a phenomenon called cortical spreading depression. Imagine a rock thrown into a still pond. A ripple expands outward in your brain. A massive wave of electrical excitation moves across the surface of your cortex at a rate of about 3 millimeters per minute. As this wave moves, it fires every neuron in its path, causing you to see flashing lights or zigzag lines. But right behind that wave is a trough of complete electrical silence, a depression where the neurons stop firing entirely. This is why after the bright lights, you might have a blind spot or tunnel vision. This brain tsunami doesn't just stay in the visual center. If the wave keeps spreading forward into the parts of the brain and that control sensation, you might feel tingling in your hand that travels up your arm to your face. If it hits the language centers in the left hemisphere, you might suddenly find yourself unable to speak or understand words, a symptom called aphasia that can mimic a stroke. It is a terrifying experience, but it is temporary. It's essentially your brain's circuits rebooting one by one. But this massive electrical event comes at a cost. It requires a huge amount of energy, leaving your brain metabolically exhausted, which sets the stage for the pain that is about to follow. Now we enter the attack phase. This is where the trigeminal vascular system wakes up. You have a massive nerve called the trigeminal nerve that spreads across your face and wraps around the blood vessels lining your brain. So when that electrical wave washes over the brain, it dumps irritating chemicals onto these nerve endings. The nerves react by releasing a potent protein called calcitonin gene-related peptide, or CGRP. Think of CGRP as a distress flare. It causes the blood vessels to swell and creates a soup of inflammation around the brain's covering, the meninges. Every time your heart beats and pumps blood through those swollen vessels, it bangs against those sensitized nerves. Throb, throb, throb. That is the mechanical origin of your pains. But the pain isn't just in the head. As the attack continues, the central nervous system becomes sensitized. This means the neurons in your brainstem and thalamus start firing at everything, not just pain signals. This is why you get photophobia. Light actually hurts. It's why you get phonophobia. Sound feels physically painful. It leads to a condition called cutaneous allodynia, where even the touch of hair brushing against your scalp or the weight of glasses on your nose feels like burning sandpaper. And your brain has lost the ability to distinguish between a gentle touch and a painful blow. Everything is interpreted as a threat. Once the pain finally subsides, you aren't just back to normal, you enter the postdrome, often called the migraine hangover. Your brain has just run a marathon without training, and it is depleted of energy molecules and neurochemicals. Patients often describe feeling like a zombie, confused, exhausted, and depressed. This phase can last another 24 to 48 hours. If you add it all up, prodrome, aura, attack, and postdrome, a single migraine event can steal 3 or 4 days of your life. It is a systemic disablement, not a momentary headache. So why does this happen to you and not your neighbor? The answer lies largely in your genetics. We used to think of this as just bad luck, but we now have identified dozens of genetic variants that increase migraine risk. Many of these genes control ion channels, tiny gates on the surface of your brain cells that let calcium and sodium in. And out in people with migraine, these gates are leaky or hyperresponsive. They allow neurons to fire too easily, and we call this a channelopathy. Your brain is essentially a high-performance sports car with a hair trigger accelerator. It's fast and sensitive, but if you tap the pedal just a little too hard, the engine revs out of control. This brings us to the threshold theory, or what many patients call the bucket theory. Imagine you have a bucket, and the size of your bucket is determined by your genetics. If you have migraine, your bucket is naturally smaller, and every day triggers drop water into your bucket. Stress is a cup of water, a glass of wine is another cup, a poor night's sleep is a pitcher, a drop in barometric pressure is another splash. On a good day, your bucket can hold it. But if your bucket is already half full from stress and hormones, that one piece of chocolate might be the drop that makes it overflow. And the overflow is the migraine. The goal of treatment isn't to live in a bubble and avoid every trigger. It's to make your bucket bigger so you can handle life splashes without overflowing. For decades, we treated this overflowing bucket with medications that weren't designed for migraine. We use blood pressure pills, anti-seizure drugs, and antidepressants. And for the acute attack, we use triptans. Triptans are effective, but they work by clamping down on blood vessels. This means they can be dangerous for people with heart conditions, but we are currently living through a golden age of migraine research. We have moved from the vascular era to the neuropeptide era. Remember CGRP, that inflammatory protein we talked about earlier? Scientists have figured out how to target it directly without constricting blood vessels. We now have a new class of drugs called gepants and monoclonal antibodies. These are precision weapons. They act like a sponge, soaking up the CGRP or blocking its receptor, effectively stopping the inflammation signal before the pain can take hold. Because they don't shrink blood vessels, they are safer for many more people. We also have dietins, which target specific serotonin receptors on nerves to shut down pain pathways without touching the arteries. For the first time in history, we are treating the neural mechanism of the disease, not just the symptoms. But medication is only half the battle because your brain is hypersensitive You can train it to be more resilient using non-drug methods. And one of the most evidence-based techniques is thermal biofeedback. It sounds simple, but it's powerful. And by training yourself to mentally warm your hands, literally visualizing heat flowing into your fingers, you activate your parasympathetic nervous system. This is your rest and digest system. It acts as a brake on the fight or flight response that fuels migraine. Regular practice can actually raise your threshold, making your bucket bigger. We also can ignore the fuel your brain needs. Since the migraine brain is an energy guzzler, supplements like magnesium, riboflavin, vitamin B2, and coenzyme Q10 act like high-octane fuel for your mitochondria, the power plants of your cells. Magnesium specifically helps stabilize those leaky ion channels we talked about. It acts as a gatekeeper, preventing neurons from firing when they shouldn't. It's a simple, natural way to calm the electrical storm before it starts. And if you take nothing else away from this conversation, I want you to take this. Your pain is real. Your fatigue is biological. The sensory overload is neurological. You are not weak for having a smaller bucket. You have a genetically complex, highly sensitive nervous system that requires specific care. You are managing a chronic neurological disease every single day, and doing so takes immense strength. There is so much hope on the horizon. With these new targeted treatments and a better understanding of how to manage our thresholds, we are moving toward a future where migraine doesn't dictate your life. Check the description below for links to the organizations and research we used today. Educate yourself. Find a specialist who understands CGRP and the modern science of migraine. And never let anyone tell you it's just a headache. You have the power to take control. Thanks for watching, and be well.